South Arkansas mother, who is also a nurse, is raising awareness about sudden cardiac arrest after losing her son at the young age of 16 due to a heart defect. NBC 10's Chelsea Monet has this story.
Michelle Temple says her son Grayson was a student athlete whose heart condition went undetected.
Back in December of 2021, our son Grayson started having issues with his heart. At the time, we didn't know it was his heart. He was experiencing extreme fatigue, dizziness, palpitations.
Grayson told his parents he had seen the school nurse about the way he was feeling several weeks prior and was advised he was dehydrated.
And unfortunately, a lot of times cardiac issues in children do get discounted as dehydration.
A trip to the cardiologist on December 6, 2021 revealed Grayson needed immediate attention and was directly admitted into the ICU. For 3 days, doctors did what they could.
The third day, he went into sudden cardiac arrest and he passed away.
Michelle says her son was in picture-perfect health.
You know, he was the picture of health. He was 16, 6'3", 230 pounds, played sports, fished, was always on the go, was never a sick child, like ever.
Saying as a nurse, she felt horrible for not catching it, but instead of blaming herself, she spent a lot of time researching his condition.
We actually did genetic testing and found out that he had a predisposition to a cardiac arrhythmia known as long QT.
Michelle says that's when she and her husband decided to start Gray's Army Foundation, a nonprofit dedicated to raising awareness for sudden cardiac arrest, especially in student athletes.
It is the #1 cause of death in our student athletes.
Gray's Army travels to promote hands-only CPR in schools and churches.
We had a very generous donor who provided us with our mannequins and AED trainers so that we can go and teach the hands-only CPR.
In connection with another nonprofit, Gray's Army works to get AED trainers into schools at reduced rates if needed, saying they are important to have on hand because it just may save a life.
Because an AED used within the first 1 to 2 minutes increases a person's chance of survival up to 90% when sudden cardiac arrest occurs.
Michelle explains it's important to know the signs and symptoms of sudden cardiac arrest, what to do should someone stop breathing, regular and thorough heart screenings, and knowing your family's medical history. In June 2022, the Grayson Temple Act was passed in Louisiana. It requires all coaches, athletic trainers, and school nurses to take a yearly training that teaches recognizing signs and symptoms of this condition and how to address it. For more information about Grayson's story and this condition, visit graysarmyfoundation.org. In El Dorado, for your weather station, I'm Chelsea Monet.
Heartwarming story. Thank you, Chelsea. Well,